Hello everyone, I am Dr. Shamsundar, radiation oncologist from Precision Oncology Clinic. Today I will be talking about role of radiotherapy in CLM. Usually when you hear about carcinoma lung, the most commonly you will hear about chemotherapy, immunotherapy, and then sometimes surgery. Very less you will hear about radiation or radiotherapy. But actually about 75% of the lung cancer patients will require radiation at some point of time, either as a radical treatment, that is curative treatment, or in some instances as a palliative treatment where we use it to palliate the symptoms. So coming to the uses of radiotherapy or how radiotherapy can be used in carcinoma lung. So first it is used in very early stage lung cancers, that is stage 1 and early stage 2, where the disease is localized only to the lung and it has not gone anywhere including the lymph nodes. In these situations traditionally surgery has been the treatment of choice, where the patient undergoes surgery and excision of that lesion. However, what used to happen, most of the patients who had lung cancer were not fit for surgery. So, on those patients, surgery could not be performed, and that is when people started using radiotherapy in these patients. However, previously in olden generation, because the radiation machines were not very refined, patients used to have a lot of, side effects, and the radiation in early lung cancer was restricted to a very small number of patients. However, with the advent of technology and introduction of newer linear accelerators, that is the newer radiation machines and newer techniques, radiation in early stage lung cancer has become very safe and very effective. So especially in stage 1 and early stage 2 cancer, we use something called as SABR or stereotactic ablative body radiotherapy. Here we use a high dose of radiation in a small number of fractions. That is, we usually treat it in a single day or in 3 days or in 5 days. So we will deliver a high dose of radiation in less than 5 or less than 5 days, and the disease itself will get burnt or will get treated in the lung. So there is no admission advised. It will be a daycare procedure. The patient will have minimal side effects. The most side effects it can have is a little bit of cough. There is not much side effect if the patient is chosen wisely. So what are the advantages of radiotherapy over surgery in early lung cancer is that it is absolutely indicated in those patients who cannot undergo surgery. For example, patients who are very elderly, who have issues with their cardiac issues or diabetic issues, hypertensive, other comorbidities, or patients who have a less lung reserve, that is the patient is not able to breathe, the other lung is also damaged. So in these patients doing surgery will be very difficult and very risky. In these patients, definitely radiation can be used. Second, in those patients who are also fit for surgery, but the disease is well located, well localized, not spread to anywhere, early stage, and again they can go for stereotactic body radiotherapy, because it will be absolutely daycare procedure, no risk of anesthesia or anything. Patient did not get admitted. Probably it will take about 45 minutes to 1 hour every day treatment, and it will get over within a week's time. So these are the advantages of radiation in early lung cancer, and the outcomes of SABR, that is stereotactic body radiotherapy in early lung cancers, is almost similar to the surgery. So there is no difference in terms of outcome or cure. Now next, coming to stage 2, that is advanced stage 2 and stage 3 disease. Here radiation along with chemotherapy is the standard treatment. Here we don't use the stereotactic body radiotherapy. Here we use more conventional radiation, where the patient gets about 30 days of radiation along with chemotherapy. Here again, the cure rate depends on the stage of the disease, the extent of the disease, the histology, and other molecular markers. Patients who have a more favorable molecular profiling will do much better than those who don't. However, when you come to stage 4, here the main treatment is chemotherapy. Radiation here is more in terms of palliation. So if at all the disease is spread to the brain or to the bone, or patient is having difficulty or other symptom, then we use radiation there to palliate the symptoms. So in the end, radiotherapy forms part of the treatment for carcinoma lung, either as curative in early lung cancer and in stage 2, stage 3 lung cancer along with chemotherapy, and will also be curative in advanced stages of lung cancer. What I want to stress here is that radiotherapy, especially stereotactic body ablative radiotherapy, is a very good alternative to surgery in early lung cases who are fit or unfit for surgery. In both of these populations, we can use this procedure very safely and with excellent outcomes. Thank you.